Today I am going to talk about the disease leukemia. Leukemia is also called by the term hematological cancer. This syndrome develops when the bone and marrow and the blood gets affected. Therefore, the production and function of these cells gets impaired, that is fighting against infection and transport of oxygen, and the cancer cells grow out of control. Types of blood cancer: leukemia, lymphoma and myeloma. Leukemia. It is a type of blood cancer which affects the leukocytes or white blood. Leukemia. It is a type of blood cancer which affects the leukocytes or white blood cells and bone and marrow. This condition generally occurs when a body produces an excess of abnormal WBC. Therefore, there are four main types of leukemia, namely acute myeloid leukemia, acute lymphoblastic leukemia, chronic myeloid leukemia, chronic lymphocytic leukemia. Acute myeloid leukemia (AML). It is a type of blood cancer where the bone and marrow produces too many abnormal white blood cells, specifically myeloblasts, which interfere with the production of healthy blood cells. It is a fast-growing cancer, often requiring immediate treatments. Symptoms: fatigue, shortness of breath, frequent infections, easy bruising and bleeding, bone pain, swollen lymph nodes or spleen. Acute lymphoblastic leukemia. Acute lymphoblastic leukemia is a type of blood cancer where the bone and marrow produces too many immature lymphocytes. These immature cells are called lymphoblasts, are unable to function properly and crowd out healthy blood cells, leading to various symptoms and complications. Symptoms. Common symptoms include fatigue, pallor, fever, easy bruising or bleeding, enlarged lymph nodes and bone pain. Chronic myeloid leukemia. Chronic myeloid leukemia is an uncommon type of cancer of the bone and marrow. Bone and marrow is the spongy tissue inside bones where blood cells are made. CML causes an increased number of white blood cells in the blood. Symptoms: fatigue, weight loss and abdominal discomfort due to an enlarged spleen may appear. Chronic lymphocytic leukemia. It is a type of blood cancer where the bone and marrow produces too many abnormal lymphocytes. These lymphocytes can be B cells. CLL is a slow-growing cancer, means it can take a while symptoms to appear. Symptoms: enlarged but painless lymph nodes, fatigue, fever, pain in the upper portion of the abdomen, enlarged spleen, night sweats, weight loss, frequent infections. Lymphoma. It directly affects the lymphatic system, which acts as a shield against infectious disease. It may affect blood cells, spleen and bone and marrow. There are mainly two main types: non-Hodgkin lymphoma, Hodgkin lymphoma. Non-Hodgkin lymphoma, a group of cancer that originates in the lymphatic system affecting white blood cells called lymphocytes. Symptoms: swollen painless lymph nodes, unexplained fever, night sweats and persistent fatigue. Hodgkin lymphoma. It is a type of cancer that affects the lymphatic system. The lymphatic system is a part of body's germ-fighting immune system. Hodgkin lymphoma begins when healthy cells in the lymphatic system change and grow out of control. Symptoms include swollen lymph nodes, fever, night sweats, unexplained weight loss and fatigue. Causes of blood cancer. There is no certain reason for the causes of blood cancer. Some factors are related to age factor, hereditary, weakened immune system, infections, age, smoking, excessive alcohol consumption, exposure to chemotherapy, organ transplantation, usages of hair dyes, some kinds of petrochemicals and maternal fetal transmission in rare cases. Treatment for blood cancer. Treatment of cancer depends on the type of cancer, age, severity and many other factors. Treatments are radiation therapy. Radiation is given to destroy cancer cells. They make use of high energy X-rays. It also relieves pain. It is conducted before stem and bone marrow plantation. Stem cell transplantation. Stem cells are collected from bone and marrow, umbilical cord and peripheral blood. They inculcate healthy blood forming stem cells. Chemotherapy. It is a treatment that involves drugs that are mainly given to destroy the cancer cells. When to see a doctor? If you have a persistent fatigue, unexplained fever or chills, frequent infections, easy bruising or bleeding, swollen lymph nodes or bone pain, it's important to see a doctor. If you want more information, please like, share and subscribe to my channel. Thank you.